Dear audience, welcome to the show POWERchat. In today's episode, we are discussing about genetic disease and test in Nepal. Joining us today is Dr. Nilam Thakur, Nepal's first geneticist. Please allow me to welcome her. Welcome to the show, Dr. Thakur.
Thank you, Laxman.
How have you been?
It's good.
Well, you have been into this field for a few years, and you are among very few geneticists working or practicing here in Nepal. What motivated you to study genetic science, and how do you think that your study is contributing to Nepalese society?
Yeah, it was interesting story actually. Yes, I'm first geneticist, and to be a geneticist in developing country like Nepal is really challenging. So the thing is, I was really interested from my beginning to become a genetic engineer actually, and unfortunately I became a doctor. So engineer turning to a doctor, and then in doctorate I was thinking that in what capacity I could do my genetic work out here. And there was no courses for clinical genetics, and suddenly I got this buzz that there is a course happening in NOMA grant, that course is clinical genetics, and one developing country where you can apply is Nepal. And then I said, okay, now this is my way, and actually I entered in clinical genetics. Actually, I'll say you an interesting thing. My father was like, I have to drag him to NAMS that please sign this, I want to study this. So, and that's how I studied this.
Really interesting. I will come back to you on the curriculum and all. What is the scope of genetic study in the countries like Nepal? There is, very little awareness about this issue, I guess.
Yes, awareness is really less, because in a country, if you have the system, then the people will understand, and then only they will send you the patient. The patient will, or a person will come to you. So before me there was no system. So there was no system of taking any patient of genetic disorder in healthcare system of Nepal. So first 3 years of my life was really tough, because everybody was saying that no, there is no system. So like clinical geneticist, there is no post, there is no OPDs. Where do you stand? In which capacity? Do you belong in medicine or in pathology, or where do you belong? So it was really challenging, but now I think after 7 years time, now there is a National Referral Center. So it's really evolving day by day. But I think there are a lot of challenges.
How did you convince the system? You're referring to the system that there were no recognition of this subject when you came back to Nepal.
Yes, it was really tough, because like Nepal Medical Council doesn't have this subject, NAMS doesn't have, Bir Hospital doesn't have, so where do you stand? So I asked that, give me a chair, give me a OPD, I'll show you the aspect of this disease. And then going everywhere to the doctors, to patient, I'll say you like openly that few doctors have thrown me out. There is no point of a geneticist coming in developing country, go back. But then I said, okay, I'll create the possibility, because you have to create your own opportunity.
But you are in here now.
Yes. And then I said, okay, once they will get the reports, once they will have this thing, then only they will understand what is this, the possibilities. So, and then I started to work on how you create this healthcare system management in government system, and that's how Medical Genetics Unit of Bir Hospital has established 3-4 years back.
What is genetic study in general, and how genetic diseases are understood in the context of Nepal?
I think it's really very poorly understood, because most of the our focus of healthcare is mostly done for infectious diseases or any communicable diseases, basically, because it's developing country. But non-communicable diseases and especially genetic disorders are there. So now the priorities have been changing, because like now you are getting counseling, you are getting testing being done in Nepal. So now the scenario has changed, but definitely yes, it was nowhere when I started here. Now like say example, sickle cell anemia. It is so much prevalent in our country, but then nobody was actually looking into it, that this disease is really a public health problem. It is not an individual problem, it is a public health problem. Genetic disorders actually are public health problems. So now even the government is looking into it. Yes, this is public health problem.
Is there any substance within the research and studies being carried out here in Nepal, also associated with the NHRC?
Yes, there is a national screening program for sickle cell anemia. So I'm working there for Nepal Health Research Council. So the result will be published in this year. So we are waiting for a national screening project of sickle cell anemia.
Could you tell us the general, genetic diseases, so that our audience understand?
Okay. The thing is, like, not general, we cannot generalize it, but what I get a lot of, like, most of my patients are infertility, recurrent pregnancy losses, bad obstetric history. Then another one is breast cancer, colon cancers, leukemias, and then comes syndromic babies. The most important syndromic: Down syndrome, Turner syndrome, Edwards syndrome, Patau syndrome. There are like even like something like metachromatic leukodystrophy. I get a lot of patient here. So lot of different diseases are there. But these are the major bulk, though we do not have any data to show you in our national registry, but then definitely maybe in couple of years we'll get our own database, so to have which diseases are prevalent in our country.
The diseases that you are referring, I guess, are in prevalence for a long time here in Nepal. How people are, getting treatment to these diseases, because your, area is new here in Nepal.
Yes. So now what happens is, most of the time if you have a genetic disorder, if a child has it, then there is no treatment for it. So normally people say that, okay, fine, you have one child. Sometimes even 3-4 child with the same disorder comes, but then they have no option normally. And then if the people are affording, they go to neighboring countries. That's the only option. There were no options for those disorders.
Well, what are the problems associated with genetic disease? I mean, what are the main challenges?
The main challenge is laboratory testing. The technology is too high, so all the machines, all the technique what you use for genetic testing is really difficult. Not in capacity of economic thing, it's in capacity of your technical manpowers, because in our university there are no courses for molecular biology, there are no courses for bioinformatics, there are no courses for anything related to genetics, cytogenetics or hematology, anything. So you do not have a lot of trained, skilled manpower to run that lab. And then another thing is economic burden, like the machines are too expensive and the laboratory has to be very sophisticated, so it's not there. So that is the main challenge. And then the costing of genetic test is a bit higher, and so that people like all general public cannot afford it. But definitely by, like, I'm looking in last 10 years, so it's dropping down. Like what you could do in $1,000, now you can do in $10. So it's dropping down. So let's hope that it will drop down a bit more, so that our people can utilize all those.
It must be tough for you to engage in several initiatives. You are serving at the NAMS Bir Hospital, also in the private initiative you recently started with the diagnostic center. Could you tell us a little bit about the services that your center is going to provide, and also tell us about the affordability of the services?
Okay. The thing is, I am associated with NAMS, that is a government body, and there is a certain test has been being done there, and genetic counseling is being provided there. Now, at one point, you do not have all the systems in government. So I started to say that, okay, why not in private? So what motivated me to come into private is, in 2017 I went to NIH, and there as a fellow they showed me a paradigm. Okay, now look, this is the paradigm of the genetic testing. Can you do it in your country? And then they showed us a GeneDx company, which was a private company which is doing a lot of work. Whether it is private or government, the service has to be there. That's why we started our lab, Nova International Diagnostic. It is a diagnostic branch of Kathmandu Center for Genomics, which is a research laboratory. So as we started it, and there are few services, mainly 5 advanced testing we are offering, like non-invasive prenatal testing, where you could take blood from mother and test the fetal DNA, so that Down syndrome you could diagnose very early. And then another is a pre-implantation genetic screening. Another is BRCA1 and BRCA2 for breast cancer. So if one person in your family has breast cancer, then you could test all your family members whether they can have those cancers or not. And then another is cancer hotspot. So these are basic tests, but apart from this, all the genetic disorders we could test in our lab. Any sort of genetic disorder, like whether it is muscular dystrophy, thalassemia, sickle cell anemia, hemophilia, whatever, we could test in our lab.
Very interesting. Do you think that the center will be able to provide solution to these, problems you referring from the beginning?
Yes, it could, because like this is a pure reproductive center. So if you enter with a problem and we test you, and then we see a problem, and then we'll do what we'll give you solutions, what you can do. Even like if I have, let's say I have a disease, I come to you and I ask, this is the disease, can my baby have that? Then we offer them prenatal testing. So amniocentesis can be done in one center. Anything related to genetic thing can be done in one center, so that people will not do not have to go to every other hospital. So in one center you come, you'll have your solutions and go out. So that definitely it's going to help.
Well, what are the major reasons behind genetic diseases?
Reasons, yes, there are a lot of first thing you have to understand that genetic disorder does not have any particular reasons, but for a country like us, some diseases have prevalence, like sickle cell anemia. So if the parents have, you have that disease. Then consanguinity, near relative marriage, that is another problem which we certain tribes in Nepal has that thing. So it also adds on these.
Yes, it is widely heard that marrying among or between blood relatives causes genetic disease. Is that true?
Yes, it's true. It's autosomal recessive. Mostly autosomal recessive disorders are in consanguinity. So I strongly say, do not marry. Consanguinity is almost prohibited. But in our country, there is 2 good things. Like majority of our population is Hindus, and in Hindu Marriage Act you cannot marry in 6th, 7th generation. So that is really helping us to like overcome the disorders. But other tribal groups where it has, they have a lot of autosomal recessive disorders.
Well, and any substance or any data about the number of patients here in Nepal, the disease caused due to genetic disorders?
There is not substance, I would say, but then it needs extensive research to say something like this. But there is no data, initial data. Then there is no research is being done. So we definitely we see a lot of things, like less than 50 cancers down in 3 years down. I have seen a lot of patients. I do not know why. Because we do not have any research being done, no database, how the mutation is changing, we do not know anything. That's why I'm asking everybody from funding agency that let's fund it and let's see what is happening to our population. And then a lot of time I ask to a lot of researchers, as you know, I'm involved I'm involved in a lot of researches. So they ask me to collaborate, but it was very difficult for me. Now next generation sequencer in our country would help us to contribute to that, finding out that cause as well, like let's say breast cancer and why it is happening to our population in less than 30. So we could really understand that how it is happening. So cause is still we cannot say before.
You engaged in many initiatives, and I guess these are very good initiatives. But what are your thoughts on having access to all patients, especially in trust? How can it be extended?
Yes, you asked me a very good question. being first and only geneticist, it's very difficult for me. So now I'm trying to talk with many universities that we have to have a lot of courses, not only in clinical genetics, we have to have courses even in molecular biology, cytogenetics.
Are they willing to introduce these courses or listening you?
It's tough, because like to teach them also there has to be faculty, there has to be proper training, and there are very less manpower. Definitely maybe in 10 years down we'll get some few courses down, but it's very difficult. We have to have at least few people, because one people for this much population is one person, one doctor for this whole entire population is not happening. Now people from like all mountains, Tarai, from everywhere they have to come here. So there has to be more and more people, more and more doctors trained in clinical genetics. So
when can we expect that the universities or training centers would start with the courses so that many people come into this profession?
I think in your program a lot of people comes from politics, so you have to ask them. I mean, no, the thing is there are if you have a lot of people, a huge voice will come, and that voice will raise to your university or stakeholders, or you could say policy development people. But in our case, definitely we do not have a lot of people talking about it. So it's like I have to go and talk to everybody, like how you develop a curriculum, how you develop this. So now I'm planning for at least 15 days or 1 month course, then I could extend that for 1 year.
Did you talk to the concerned ministry, I mean Ministry of Health and Population? What is their response?
First I have to talk with the health ministry, because clinical genetics is coming for health sector. So first we have already initiated at NAMS, because it's a National Academy of Medical Sciences, a tertiary care center, and all the courses are being conducted there. So my first job is to incorporate genetics in all MD facility. Like MD medicine you are doing, you have to study at least 1 month, you have to study this. So this year, that's I think it's a very good achievement for me, because this year one of the MD courses has included genetics, and a lot of people want to include it. So maybe in year down or 2 year down we'll have all the subjects having genetics study. So once they will understand, they will start talking genetics, then only we could think of a bigger course.
That can be way forward towards specialization.
Yes, so maybe 1 year fellowship or something like that we could start. But first, at least all the doctors, all the MDs has to talk genetics. So they should understand that how it will help. That's why I thought that why not I should be keeping all of the courses 1 month mandatory courses, so that they could come and they could learn, and then they will start talking, okay, we want to study this.
What is the role of the health ministry? Are they not putting this agenda in their priority, so that universities are not willing to have course and studies?
I would not say a priority. I would say that it's a very new subject, right? And there are not many people. So everybody or every stakeholders or every policy making people will be a bit of how they will do, what is the way forward. They do not know. I know genetics, so I talk. So if let's say they will start a course, then there is no proper laboratory to start the course. There are no PhDs here to talk about this. And then there are some like a lot of wrong things happening in wrong places also. So there are no
Don't you think that the willpower is needed and resources can be managed? You are here. You can ask someone else to be here in Nepal for a few years to teach the new generation.
You said correctly, willpower is needed. I mean, for 3 years I was like on roads. So I had that willpower that I'll do it in Nepal. A lot of people said, no, go back to Norway or go back to Sri Lanka. There were a lot of things. My parents were saying that, why don't you study gynecology? Why you are wasting your time in this? A lot of people were. I also got frustrated at times. But then I realized that impossible always says I am possible. So I have to do this. Whether I have whatever I have to do, I will do, but I'll talk about this. And after 6 years time, I'm sitting here talking to you about genetics. So things are possible. It's just that you need to have correct people in correct places.
What are your key recommendations to the government of Nepal? Ultimately, policies are formulated by the government.
Yes. I think my way forward would be that do not only prioritize all those diseases which are prevalent here, something like tuberculosis or infectious diseases, communicable diseases. Non-communicable diseases and especially genetic disorders are really a big issue, because you can only prevent it. You cannot cure it. So prevention has to be developed, and for that development you need to have manpowers. You need to have a center, not only one excellent center. There has to have lot of centers where they could work there only. They don't have to travel out here.
There are many health institutes, health policies as well, private sector engagement in hospitals, and do you think that they are not engaged in the practice of genetic studies or genetic treatment or test just because of the lack of manpower, or they are not willing to do this?
Thing is, a lot of work with a lot of very few results. That's one factor why people are not interested in doing genetics, because you have to work very hard, and then you have, at the end of the day, you have very less result, and again in that result you have to work. So that sort of dedication, like we as a people is scared of that sort of dedication. And then another thing is, you cannot make a lot of money out of it. So I cannot have a lot of clinics, I cannot have a lot of like income generating things. So that's another thing. And then another thing is, it's very difficult to study as well. All those sequences and everything, everybody asks me, you are mad, you study genetics. I don't understand anything in genetics. So it's very difficult to study as well. So that is one thing. And then another thing is, in stakeholders, I would say stakeholders in all government sector, there has to be people who will think like that. Right now I'm asking for, even for sickle cell anemia, we had this, and for the first time I asked them, why don't you start the molecular testing, why don't you start, and for the first time they said, okay, for your sake I'll start molecular testing. So now this year we'll have result of that molecular testing. Now I'm asking them, okay, one gate is finished, why don't we do sequencing of these samples, then we'll have our own database. So now they are also getting ready for that. So once we'll have 2-3 papers, 2-3 results of our own population, then maybe people will get interested.
Are you of the opinion that medical practice is being influenced or dominated by the business these days?
Not actually, but at times yes. I have seen this. I'm not a very commercial person, but I have seen that. Even as a patient, when I go, I have seen. But then I don't say like everywhere it's there, but then in every profession there is like some sort of business. So whether you take engineering, you take journalism, so everywhere it's business. So there will be few people who will be having business, but there are few people who works for for your fraternity. So I would not say it's all business, but definitely they also have to run their families.
Well, Dr. Thakur, you are sharing many interesting issues, but we are coming to the end of the show. Any final thoughts that I have left to ask you very quickly?
I think from this forum I would say that please think that genetic disorders are there in our country, and let's start testing, let's start doing things, and then only we'll have an idea that what is happening. And all the other people, like here whatever research we do, we are only third party. So now genetic things are being done in Nepal, so that's a huge development. So all the researches can be done in Nepal. So let's start thinking, think beyond your imagination.
Well, Dr. Thakur, it was a pleasure talking to you. Thank you very much for your time.
Thank you so much for calling me here.
Dear audience, time now to wrap up the show. Keep watching us. See you next week. Namaste.